counselors are full of shit. I see so many people, what they train you in school and what happens in real life are two different things, and depending on your population that you work with, I probably wouldn't tell a mom that their kids is full of shit or something, Think about this. When you go to driving school, they teach you 10 and 2. And how many people are on the road 10 and 2? How many people are checking stop signs? How many people, like the way that they train you to drive will probably get you killed. And I would say the way that they train you in school will probably get your client killed, and I'll give you one example. The textbooks and all that type of stuff. Like I'm a person in recovery from substances. I never took one drug class in college or, bachelor's or master's school, but I would never train that to my persons that's in recovery. I'll give you one example. The great models that we are kind of forced to use in the system that we use would not work. Somebody's coming off heroin. And one of the tricks is that they trade you is, put a rubber band on your wrist and snap it every time you have a trigger. Now, I've helped thousands of people in treatment groups from PHP, IOP, I've worked in the hospital. I've literally been there on the scene when somebody overdoses on heroin. And for me to be like, hey buddy, I need you to snap a rubber band on your wrist every time you're thinking of heroin, has no idea the multitude of what drugs do to your body. I've never been in treatment and somebody's ever been like, you know what, today I've been sober for 6 months and I'm gonna leave today and I'm gonna completely fuck my family over today by snorting a drug, injecting a drug. Like, that's bullshit. That's not even the steps that people take. So I see so many young therapists trying to help people get out of drugs and they're training that. Or they're just like, hey buddy, hey, change your thinking. Hey, change your mind. Now, I'm not saying cognitive behavioral therapy doesn't work, but for the population that I'm dealing with, that makes zero sense. There's many research videos that train you on that, and the opposite of addiction is not recovery, it's connection. Because people don't feel connected to society, right? The most successful program that we have in addiction is 12-step meetings, but it's the community that connects people, because most people that are in addiction don't feel connected to the real world. The counselors would be like, what are you talking about? But the addicts and the junkies and the felons would exactly know what I'm talking about, right? Like, I don't know how to fill out a job application. I don't know how to dress right. So a lot of the stuff that we learn is, mindfulness, which is great. That is great. But, for people like me, people that never fit into the school system, people that got kicked out of schools, people that said you would never be shit, that will not work with this population. They teach you in school how, they teach you, the manual on how to drive a car, but that shit will get you killed on the street. Nobody's doing 10 and 2, right? And most of the stuff in the packets that I see won't help a person in recovery either. So when it comes to actual therapy, one of the tips, probably get in trouble here, the school of social workers says you can't cuss around a patient. I used to, like, this real life happened to me. There was a nurse, he was getting trained, he was going through nurse practitioner school, and he was being trained, and there's a bunch of them too, on, the social worker school code of ethics, and they would say, don't cuss, you can't cuss around a patient, I guess I won't tell on myself here, but I do a lot of fucking cussing around my patients. That's a normal thing. And the people that started, the field and social worker, I'm not backing them up or nothing, like Sigmund Freud and all these people would tell you that cussing actually goes above the social norm and actually gets into their head, so I guess in real life I do cuss a lot too, but around patients, speaking their language, not trying to be cool or not trying to fit in or something like that, but understanding where they come from. Connection is the most important thing you can do for a person in recovery. Take my personal story out of it, if I was a therapist working with an individual, I would get down in the nitty-gritty with them, not trying to relate or compare, but trying to understand their culture and move there forward. I think the most successful therapy, technique to change somebody's thinking is to give them a life that they never had, give them opportunities. If I'm coming in off drugs or I'm coming off a psych hospital visit, you need to change their life immediately. Going over the hierarchy of needs is the most important thing, All that opportunity is great. When I was incarcerated, they told us that these certificates would like change our lives, and I had to go through anger management And I went to my first, I was trying to give it to a corporation, Bob Evans, and this dude probably thought I was a psycho because I presented my certificates to him, and he's like, what the hell is this? And I'm like, dude, I finished anger management. Can I please can I please clean some dishes? And like, that didn't work at all. And I never had a job at Bob Evans, I still eat there today, I have no resentment towards them, but and I had all these certificates. My GED is literally from the Ohio Department of Corrections. That didn't help at all either. Showing up to an interview, still to now, you can take a look at my GED, and it's the Ohio Rehabilitation Department of Corrections. I look like an idiot, and a lot of these certificates were bogus. These programs would come in and give the hype, and then you got your college credits from prison, showing them to the real life, and nobody cares about them. It's all made up. We spend millions and millions of dollars on these certificates. So, the biggest thing is like creating opportunities for people. It's been most successful in my career, and having a real relationship with somebody that you could speak to them like that hey you just came off heroin and you're about to snort cocaine. You think that's a good idea? Now you're going to do it safely. Building a therapeutic alliance is the most important thing, I think, with this population. Walking them through step by step. So again, my name is Jacob Spellis, owner of Vital Health. If you have any more topics that you want, please leave a comment and we'll get back to you soon.